Well, welcome everybody to Palliative Care Australia's Oceanic Palliative Care Conference for 2021. And I know this has been the hardest of 2 years and the challenges, but throughout all of it, and this is where I want to begin, your amazing staff, your volunteers, the medical professionals, the researchers, the carers have been continuing on and providing care to our loved ones at their most vulnerable time. Thank you. I really mean thank you. What you have done, it gives people comfort, it gives people support, it gives families assistance. It allows them to travel through the final part of their journey with love, care, support, comfort, and it gives their families the assistance that they need. So thank you for staying at your posts. Thank you for taking care of our most vulnerable Australians at their most vulnerable time. And I know as the son of a dad who passed in 2013, the care that he was given in his final weeks and final days made all the difference. So thank you. So as we look forwards, the Royal Commission sets out a critical role for palliative care in aged care. There's over $57 million, and that includes $37 million for palliative care at home through our primary health networks to help people who are in the aged care home care system to have the support, to have the care that they need. It's an important outcome from this program and from the Royal Commission. Equally, there is significant funding, $14 million, for in-residential aged care facilities. Now, there's already very strong support in residential aged care, but this enhances and expands the support that's available. And it helps our carers and our nurses. It also helps the residents above all else and their families. So this is a strong response to the Royal Commission, and it comes from the Royal Commission. And many of you gave evidence and support during the course of it, so thank you. Then as we go forward, obviously we have our National Palliative Care Strategy and the 6 pillars upon which that is based. In order to back that, we have in place $294 million over an 8-year period, and that's increasing, as you know. And this funding gives strong, clear support to Palliative Care Australia. And Camilla, I'm really thankful to you, to your team, to your board, to your professionals and your volunteers for all of your work, and that we've been able to partner with you on the 100 scholarships. But going forwards, our next task is to look through the hospitals agreement with the states, where there's $134 billion, at how we can best ensure that there is proper, full in-hospital care for many of those who are at their most vulnerable moments whilst they're in hospital, whether it's of age or of some form of illness or condition, and to ensure that that funding is being used to best effect and best purposes. So in this conference, I invite you to come forward with ideas and suggestions as to how to further improve palliative care. We do have a wonderful system in Australia because of you and thanks to you. And we've seen that in this last year and a half. But it can always be better. So that invitation is clear. And so I invite your ideas. We welcome your ideas. But above all else, we thank you. And I am delighted to officially declare open the Oceanic Palliative Care Conference for 2021.